Start now. Yeah, this is Jay Garlett's AA4FL in Hawthorne, Florida. And today we're going to be talking about understanding the health benefits and risks of hot tub use in hopefully a roundtable way here. People will participate here on Zoom. And this is a subject that I've certainly heard from physicians, and I'm not exactly sure the sources that everybody's getting this information. Here on 20 meters, generally, we have a medical amateur radio counselor going on to the internet today, having technical problems, so it's mostly on Zoom here today. Many of our members are medical fields, as we all know, and we're from vocations outside of healthcare as well. The discussion is not medical advice. Questions about the comments, statements, and research displayed and how it affects your health should be directed to your healthcare team. And the topic and images within are created with the aid of AI, artificial intelligence copilot specifically, and updated through originally sourced online material. And the links here are in blue on the slides here available on Zoom through the Healthcare Hams posting. And the discussion today will center around physical and medical benefits of hot tub use, mental and emotional wellness effects, potential health risks, and safety concerns. So hot tubs, water immersion, basically, versus saunas, dry heat and steam. There's a difference here, and the usage differs in different areas of the world. There's a photograph of me on the slides, and that photograph on the slide is my particular hot tub. I had gotten one for supposedly healthcare benefits, being sore quite a bit from working out in the yard, et cetera, et cetera. So, at different parts of the world, people do for different reasons, different modalities. If you're in the northern climates, you often use saunas and heat. You might have an indoor spa or sauna. Having a sauna in a house can be problematic. So there are people that do. I know my brother-in-law had one in South Florida. It takes up quite a bit of space to get the steam and in dry heat. So Japan, commonly people do use water immersion as well. So the differences in design here in the United States, they tend to, in South Florida, have hot tubs that are attached to pools. And they're generally just a circular structure with a circular rest area inside and some jets surrounding that area, and they spill over into the pool. And you have a heating source that then also ends up heating the pool. Whereas a clamshell type spa or a hot tub has many different places to sit, many different jets, different combinations depending upon the size and the manufacturer. And that gives you the ability to control what your personal experience. You can have more than one person there with different experiences. What about the scientific evidence-based effects of hydrotherapy on various systems on the body? So the use of water for various treatments, hydrotherapy, is probably as old as mankind, and it's one of the basic methods of treatment widely used in the system of natural medicine, which is also called water therapy, aquatic therapy, pool therapy, etc. But the use of water in various forms and various temperatures can produce different effects in different systems of the body. And this goes back through history. You certainly have seen photographs in Pompeii of the spas they used, and I think predating Roman times, also into the times of the Greeks. I'm going to pause for a second here. Is there somebody on Zoom that would like to tell a little bit about their experiences with spas or hot tubs, if they use one regularly and where, if they have one at home? Go ahead and unmute, and we'll go ahead and talk about it. Looking for input on Zoom. Go ahead. Okay, nothing heard on this side. But do we get improved cardiovascular effects? What actually happens in circulation when you're in a hot tub? I mean, the AI, when you do an AI generated discussion or look up information, where are the sources? I mean, are they getting these from research items? Or are they just getting them from odd websites? What are the sources of the websites? Are they scientific? Are they consumer in general? Some of the statements, and I've clarified all the statements here with basically question marks, because I'm not sure unless you research it to find the source if it's medically relevant. But enhanced blood flow to soaking in warm water help to dilate blood vessels and improve blood circulation throughout the body. And what about warm water increasing blood flow, helping muscles relax and easing pain caused by tension or injury? What about lowered blood pressure? Can it help reduce blood pressure by relaxing blood vessels and decreasing vascular resistance? What about mild cardiovascular exercise? Does soaking provide some of that, similar to light exercise, supporting health? All questions. I mean, you can find research. I found an article on the acute effects of short-term water immersion on arterial stiffness and central hemodynamics, and it potentially favorable effect on vascular health. However, the effects of short-term health on vascular function and central hemodynamics, even in this particular study, were relatively unclear. And I really could not find a lot of scientific studies on any of these particular subjects. You hear it from physicians, though. If you go to a cardiologist, they'll mention their take on it. What about muscle relaxation and pain relief? Buoyancy. If you reduce your body weight's impact, does that relieve pressure on muscles and joints for pain relief? And if you're combining warmth all of a sudden of a hot tub, does that promote faster recovery and comfort from chronic muscle pain? So benefits of aquatic exercise in adults without chronic disease, a systematic review and meta-analysis, if you search for that, or use the link that's in our slides that you can get on healthcarehams.org, you can read in more detail. Part of what it states is aquatic exercise is being increasingly recommended for healthy individuals as well as people with some special health conditions. A systematic review with meta-analysis was performed to synthesize and analyze data on the effects of water-based training programs. This particular programs for health status and physical fitness of healthy adults and adults with diseases to develop useful recommendations for health and sports professionals. So if you just specifically Google searches based upon certain words, you're not really necessarily getting scientific studies that discuss these combinations of words, but you will get a lot of what appears to be unscientific hearsay or comments from medical organizations. Give it a try. Do a little bit of search, take these slides and compare to what you're seeing here. Support for joint health and arthritis management, is that another benefit? The gentle warmth from the hot tubs, does it relax muscles and ease joint stiffness and arthritis sufferers? We talked about buoyancy in hot tubs, supporting body weight, reducing stress and painful joints during movement, that being a question. But a pragmatic randomized controlled study of hydrotherapy and land exercises on overall well-being and quality of life in rheumatoid arthritis was done. And those that attended hospital clinics were more likely to report feeling better, much better, if they're treated with hydrotherapy than are treated with exercises on land. So you'd have to extrapolate that to whether or not hot tubs themselves would be an advantage. I mean, hospital settings is not necessarily what a hot tub user at home intends, but ambulatory patients with arthritis having aquatic exercise through community initiatives may be more effective in terms of public health. We can't say whether hydrotherapy offers advantages over other forms of intensive rehabilitation to people with severe disability. So all this remains to be explored. And the question is it being explored? Let me pause for a moment. Do we have any questions or comments from our Zoom group? Go ahead.
Jay, my hospital removed its hydrotherapy equipment many years ago. I'm not sure why. It might be because they needed the space. It might be because this was seen as more as an outpatient than an inpatient thing. I'm wondering if that's part of a national trend to remove hospital hydrotherapy units.
Do we have any other comments from those others on Zoom that would like to talk about their experiences with hydrotherapy and whether or not they indirectly outside of the hospital have hydrotherapy sessions and some other clinic setting? Go ahead and call Whiskey Bravo 5 Delta here on Zoom and let me know. We'll give you the mic.
WJ8B.
Okay, Andy, WJ8B, go ahead.
The only thing I was just going to do a counterpoint. I know, my oldest son did marathons for a while, and I've had other relatives, young, but mostly young men, and either in high school or college level, doing things like trying to be a running back for a football team. And after a hard game or after a marathon, they're doing the opposite. They're jumping into a tub of ice cubes and staying there for 30 to 40 minutes after their event. And they had been told, at least by other people who do those types of activities, that it may prevent muscle damage and help recovery. So I don't think anybody else has data on that, but that at least as a counterpoint, I thought was interesting given what we're talking about.
Yeah, that is very interesting. And when hot tubs and specifically, Andy, and that's a question a little later will arise. What happens if you have a heart condition and you're getting dilation of your vessels in this warmth? I mean, you're danger of having blood pressure drop, et cetera, as your body compensates at the skin level. But what happens when all of a sudden you're in the winter and you're outside and you get out in cold air? I mean, do you go from dilation to constriction? And we can talk about that more. Any follow-up comments at this time? Andy, go ahead.
Well, certainly I've advised people to, keep the temperature down below 100 when they first get in a hot tub, because particularly those on high blood pressure medicines and on diuretics, which we use either for hypertension or even, mild congestive heart failure. Because like you said, I mean, the heat can dilate your vessels and actually make your blood pressure fall to a level that could potentially cause you to lose consciousness, which could be dangerous if you're by yourself. Because if you go unconscious and underneath the water, and there's nobody there to help you, you're in trouble. So that part is true. The constriction part from the ice, I haven't seen any data on that, and I don't remember reading anything giving advice on that.
I have something on dancers. The dancers in New York, after the Christmas show, immerse themselves up to the waist in ice baths and then stay in there for, I don't know how long, but it reduces the swelling from dancing, and then they can do the evening show too. They have to do it after every show.
Thank you, Mary.
Yeah.
AE4BX. Thank you very much for the input. And so what I'm hearing is we're talking about muscular effects from the ice and comfort in that regard. Is that correct? Okay, thank you, Mary. Do we have any other comments? Make your call to AA4FL here at WB5D.
Well, less tasteful. Prior to 1900, people used hot baths to remove parasites. That's been done all through human history.
Yeah, I remember my grandfather saying that was one treatment that he had when he came into Mexico and picked up some parasites that he needed to get rid of. That brings that to memory, and that would have been in the 1920s. So that was even in this last century. Over.
Yeah, before modern pesticides, which I think started about World War One, that was a common way to get rid of parasites and skin infections. The danger, though, of course, is that if you use a public hot tub and that has had someone in it with a contagious bacteria. I knew a fellow that was recovering from Steven Johnson syndrome. They put him in a hot tub at the hospital, and he contracted MRSA and died. That may be the reason why hospitals are removing their hot tubs and hydrotherapy units. Just a thought. N5RTF.
Yeah, thank you, Chip. N5RTF AA4FL. It might be interesting to see some, specific research on some of these topics that we're discussing. But going into the emotional wellness effects too. I mean, obviously people get in to relax physically and emotionally, and that's gone back into ancient times. And is it soothing experience to get in? I mean, what's soothing to one person may not necessarily be soothing to the next. But is there a hormone reduction, stress hormones, cortisol? Uh, does that contribute to calming the mind and body effectively from just that warmth and wet warmth? And what about the boost to mood and mental clarity? Do you have calming environmental effects, a peaceful setting itself? Or is it just the warm water that elevates the mood and the mental clarity? These are all questions that we'd like to see answered in specific settings as they pertain to different medical issues. I mean, if you're getting in a hot tub and just doing it for relaxation, that's fine if it's the end of a day and you just want to, hopefully you're not sipping too much wine, because you shouldn't be using alcohol, and you shouldn't be getting in alone, as Andy just said, necessarily as well. You have to use a little bit of common sense there. But recreational use of spa thermal waters, there's criticisms and perspectives for innovative treatments. There's an article you can find. And in that particular article, it says, after inheriting the approach to health and well-being from Greek culture, the Romans magnified this opportunity of personal and social care through the realization of monumental public baths, with major spa buildings that included areas for baths, gardens, stadiums, gyms, restrooms, and spaces for massage and health-related activities. And even in Europe to these days, you still have areas where the sites of the Roman baths, particularly the local spa-fed ones, the water-fed ones from the environment, are still in use. Is there anyone else that's been to Europe and has actually gone into into one of these thermal baths? Go ahead and make your call.
I've been to a couple of in North America. I've been to Miat Hot Springs in the Canadian Rockies, where I found I was with people from all over the world. And I've also been to the one in Glacier Peak Wilderness area, where it was a hike of more than a day to reach the spot. We had it all to ourselves, but it was great.
Thank you. What about anybody experienced in Japan using water immersion or warm baths? Anyone here with us from Japan that's done so in Japan? Now, I know in Europe, when we were in Budapest last, there were a number of thermal baths. And of course, you're looking at a combination of what, is minerals in these baths, but they have different levels of heat that you can go into when it's public. So this dates back again to ancient times, back into antiquity, back into the Romans and the Greeks before them, recognizing the well-being aspects of it. What about improvement in sleep quality? I mean, does it really help? There's an association before bedtime hot tub bathing and sleep quality in real life settings among community dwelling older adults. There's been an article with that name that positively associated the sleep metrics with hot tub bathing. So is that scientific enough? Or is it just the basis for future interventional studies to determine the optimal conditions for improving sleep quality? Because that's a generality, not necessarily a specific. What about the health risks? The group here has mentioned quite a few of the health risks and concerns already. That Chip had mentioned the spread of infection and hygiene issues, and sort of contextualize that as a possible answer to Stuart's question about hydrotherapy in hospitals, and be interested for someone to follow up with that with research, because we know bacterial growth itself can occur in hot tubs. And the discussion here was getting rid of pathogens in a hot tub, but also being in one alone, if it's not properly maintained, the potential for having health risks is there. What about the risk of skin infections? Chip N5-RTF just mentioned one that potentially led to a case of MRSA. We don't know the exact circumstances. People can get those from towels getting out of the bath as well. What about the regular cleaning? Is the particular equipment being maintained properly, especially these home spas? I mean, removing the dirt and bacteria, ensuring that it's a hygienic hot tub environment for uses. What about the balancing those chemicals? How many people really spend attention to detail and test that water regularly for pH and sanitizer levels to avoid infections and maintain sanitation? So the most recent hot tub that I bought, AA4FL, is the first one I've ever purchased. This particular one has a saltwater system like a pool. But the problem is the electronics that report the salt level, the effects of the salt level on the chlorine, are very erratic. It's not consistent. You're having to rely on test strips regardless. So what if somebody, I mean, I take the time to use the test strips and realize that what I'm seeing on a meter measurement is not accurate. What about those that don't? And is it possible that can contribute to problems? So I don't know how ubiquitous salt systems for chlorine production are for availability in spas, but considering the experience I've had, it looked like it was a very early generation. It needs some improvement. Any comments about salt systems generating chlorine for infection protection? Go ahead.
Well, you can go the other way. Our ophthalmologist isn't here today, but if you have too much chlorine or the wrong pH, it can be quite irritating to the cornea in front of your eye.
Good point. Thank you. Lots of things can be a problem with hot tubs. You mentioned earlier, Stuart, about the blood pressure drops, or maybe Andy did mention that, getting into the tub, and he suggested under 100 degrees. What about the other lethal risks that are lurking in the hot tub baths? There's a review of tragic consequences link on the slides, but recognizing the importance of the issue, the introduction of public health education can reduce that incidence of accidental deaths. But what about illicit drugs or excessive alcohol use? We mentioned passing out from your blood pressure dropping. What about somebody that's drunk? What about somebody that's got a medical condition? Andy mentioned that, or just in itself, illicit drugs or any drug that's used for a condition and the effect. You'd have to analyze the factors that contribute to bathtub drowning, and by doing so, it can yield valuable insights into medical aspects of the cases. And that includes the understanding of the role of comorbidities, drug use, medication-related adverse effects, mental health care, and genetic screening in individuals with risk of arrhythmias during and after hot tub baths. And
well, they say don't swim. They say don't swim alone, and maybe the same advice should apply to hot tub use. Even though the water is nowhere near being over your head, maybe you shouldn't go in the hot tub alone.
And I believe we've had some of that in the media in recent years, where you've had individuals in the entertainment business that have died in hot tubs. So I think that's very relevant, Stuart. WA9ZPL.
Yeah, I know anecdotally of a case of someone who was found dead in a hot tub after being there alone, and I have no idea if there was an autopsy or what happened, but there's a lesson to be learned.
Yeah, certainly you'd want to have somebody monitoring you. You know, Stuart, there was one other aspect of hot tubs from years ago, the suction, the returns were designed differently. And I had a patient who lost their granddaughter in a hot tub because their hair got caught under the water line. And even though it was probably about 2 to 3 minutes because of the heat, and they died from the experiences. I know the particular ones. I asked that question when I went looking, and the design was different, at least in this manufacturer's. But that was a real life experience of one of the families that I was a dentist for.
I know of a case of a child who died because their belly button was sucked into the drain.
Well, hopefully they have corrected all those design flaws.
Yeah.
And we talked about overheating and dehydration. We need to talk about that.
Yeah,
Yeah, go ahead. Go ahead.
yeah, I somebody I had only met briefly, but I knew of one case of suicide by a hot tub. Person got in a natural spring hot tub on private property with alcohol and drugs, and was only found like 2 weeks later. Of course, all the traces of the drugs had been destroyed by the heat. So there was never, it was ruled as an accidental death, but it was pretty obviously a suicide. N5RTF.
Thank you, Chip. AA4FL. Earlier we'd mentioned about the dilation of the blood vessels, and particularly at the skin. So exposure to hot water for long periods cause the body to overheat. So how serious are the health risks from that? The dehydration effects. If hot water exposure increases fluid loss and causes dehydration, can that cause dizziness and fainting? Another source, and I think Andy had mentioned not getting in unless it was under 100 degrees. Health precautions. Now, taking breaks and staying hydrated are essential to prevent heat-related illness during hot water exposure. I mean, who gets in a hot tub and gets out every 15 minutes to hydrate and get back in? So, safe water temperatures. This particular AI-generated recommendation said below 104, but that's also to be inclusive of resist burns and prevent and promoting safe soaking. So Andy mentioned he felt 100 degrees. I personally, because of my cardiologist saying not to get in a hot tub with a particular amount of blockages I have, he said that I shouldn't get in it at all. I set it to 98 degrees. And, I'm just not getting any scientific reason for it from him, for my particular medical case. And you see this from sources like the Cleveland Clinic, perhaps. But they don't necessarily go into the research when they talk about recommendations. And I'm not saying specifically in that particular instance that Cleveland Clinic has, but where do doctors get their sources from? I mean, how much do we trust what we're hearing from others, from our organizations, and how much personal research? I mean, we're not expert in the field. Stuart, do you have something to say about that?
Well, you're the rare person that regulates the temperature of your hot tub. Most people, if they go to a public facility, who knows if the temperature is set where it's supposed to be set, or even if you go to a friend or relative's place, how do you know that the temperature is where it's supposed to be? Also, in your case, Jay, you could bring some water or something else to sip to stay hydrated, but at a lot of public facilities, I'm not sure they allow you to bring your own beverages.
And think about the individuals that decide to hydrate with alcohol while they're in the hot tub. What would that do, Stuart?
Yeah, and people nowadays, everyone puts their stuff into a water bottle, and you don't know what's in there. It's not like the old days where you'd have some container that was where there was no doubt what was inside.
Yeah, and
You
in
wanna-
pools, you probably don't want glass containers anyway. You don't want to risk something breaking and getting into a hot tub. So that's another reason why they don't want to take the bottle with them.
One other condition bring up is people who have seizures. Obviously, that would just apply to even a bathtub and normal temperature water, but and usually hot tubs are deeper than a normal bathtub. But people who have a seizure and there's nobody there to help them, then they can easily aspirate the water and you potentially die.
Even if there is someone there, it's not safe. I know of an example of a child with uncontrolled epilepsy who was regularly taken not to a hot tub, but to a regular pool with the thinking that they would never be there alone. But you can't take that chance if someone has an uncontrolled seizure disorder.
Thank you for bringing up these discussions, guys. And from a medical standpoint, as you're both medical doctors, we're thinking about it as a health professional, but in terms of the general public, they may not even be thinking about these things at all, and their purposes for using a home hot tub they may feel are very appropriate for them and not understand the medical conditions. But once again, if somebody searches for something online, they're getting a search engine return. They're not going to know the validity of these sources. There's a lot of hearsay out there, and certainly some of it probably has some scientific basis, but everybody's situation is different. For the cardiologist to tell me not to use a hot tub, when one of the reasons why I got the hot tub is I needed for other, purported health-related items, muscle soreness and, backaches and et cetera. It's just, after looking at all the data and not really finding scientific studies on it, like not all the data. I mean, certainly you search for a few hours. And I'm not an expert in medical informatics, and very few of us are. And perhaps over time AI will get better, but it can be very misleading to the public, and it can also seem to influence health professionals on what they're telling patients. Any comments on that?
Some of the research has been suppressed. It turns out that the Nazi government in Germany during World War II was researching how to warm up pilots who crashed and almost froze to death and then got rescued. And because this research was thought to be unethical, the research has been suppressed. It's very hard to find the research, and it's considered even unethical to pick up the research where it was left off at the end of World War II. I didn't have to, but I did write a paper for a class when I was a pre-med, and I was surprised to learn this.
Thank you. Any other input? One, we talk about the ethics of this, Stuart, and everybody else that's here in the Zoom session or listening to the recording here of the Zoom session. When we talk about it from an ethical standpoint, think about some of the medical conditions one might have. So, for example, say it was a blockage of a major heart artery, or partial blockage, say 70%, and you're functioning, you have no symptoms. What puts you over the edge? Chip, you had mentioned something before, and I was thinking about you the other day. You were talking about how undervalued in taking long distance flights, how that might put someone over the edge into crisis that wouldn't be. So, we've talked about this even in the past when you're talking about Mardi Gras and Nolans and what might happen in heat, where you have this crisis that normally wouldn't occur and puts people into emergency situations. Would you like to explain, Chip, N5RTF, about the flight and altitude and the impact on medical conditions? Go ahead.
Well, I think Bernie could probably give us more information on that, but my understanding is that once you get up to cruise level, the cabin pressure by that time is down to half of atmospheric pressure. So anyone who, for example, has congestive heart failure or pulmonary disease and was doing fine at sea level, suddenly they're getting half of the air that they were getting on the ground, and people can go into a crisis under those circumstances. All of our public systems are basically designed for young, healthy adults, and yet you've got more and more elderly and ill people using them. So that's something that needs to be considered in
Well,
5RTF.
Very appropriate. Bernie, are you with us? KD5QHV, are you with us on Zoom? Would you like to make some comments?
Let's see. Where's my? I can't see my.
You're on. We hear you.
You hear me? Okay. Well, as years have gone by, the pressurization systems in airplanes have gotten much better, and you could be flying at 39, 40, 41,000 feet and have about a 4,000 or 5,000 foot cabin. Now, it's certainly not sea level, but it certainly beats the way it used to be as years gone by. And of course, that's what you want. You want something as nearly as comfortable as you can, where people don't experience any other issues. And like I say, better.
You were breaking up somewhat there, Bernie, but we did copy most of that.
You got to keep in mind that in an older aircraft, you might be at the equivalent of 7,500 feet. There are plenty of older aircraft flying around.
No argument with that.
What about smaller airplanes, Bernie? Not the commercial airlines. The people that fly, are they just subject to the outside pressure or where they're at? Over.
Well, part of the problem is the FAA also gets involved. You can't fly over 12,500 feet more than 30 minutes without having some kind of supplemental oxygen, and that's in the rules. So that's number one. Um, can you get up into the upper teens in a lighter aircraft with an oxygen system? Sure, you can. Depending on whether you're using a mask or nasal cannula, something like that, that could be a problem. With respect to how much oxygen you're actually getting. But no, you can you can do that in smaller airplanes. When you get down in the lower altitudes, the altitude is what it is. If you're at 10,000 feet, then that's what the cabin is going to be at 10,000 feet. So an unpressurized airplane, like I don't care whether it's a light twin like a 310 or a 421, or whether it's a they're gonna, if they're not pressurized, you're not gonna have a pressurized cabin, and so as a result, whatever your pressure altitude is outside is what you can experience inside. So that's typically why they try, when you do like a medevac flight. It seems to me that they're always looking for lower altitude so that they don't have as much a differential between inside and outside for the comfort of the patient.
There's another factor that these planes with the engine in front of the windshield, you can accumulate carbon monoxide in the cockpit.
I hadn't thought about that. Bernie, you had mentioned FAA, the rule, I think 12,000 feet for 30 minutes. If off the top of your head, do you know or anyone else, if you don't, Bernie, what the atmospheric pressure relationship is at 12,000 feet compared to normal sea level pressure?
No, I can't give you a number just offhand, but that's the number in the reg. Beyond 12,500, after 30 minutes, you got to have supplemental oxygen. Now, is that violated? Probably all the time, but we don't know that, and of course, neither do the feds unless something happens. That's when they typically find stuff out like that. But again, people are generally responsible enough to realize that, hey, that impacts their life too. So they usually pay attention to stuff like that.
There's a nonlinear relationship due to the S shape of the hemoglobin oxygen dissociation curve. So it's like falling off a cliff somewhere around 10,500 feet or 12,500 feet. You fall off a cliff and oxygen delivery to the brain and other tissues drops dramatically.
Okay, great. Thank you. And as I ran into a Cleveland clinic, had a return talking about are hot tubs safe if you have heart disease. So you can Google that or look it up through the link in the slides for today. So we talked about all these different issues, drops in blood pressure, the heart rate and pulse would increase to counteract the drop in blood pressure. But normally the events don't cause problems. However, what if you have an existing cardiovascular disease? The same thing we're talking about with airplanes and pressure change, getting into crisis. If you have blood vessel disease or narrowing or hardening of the arteries, what happens if you heart can't pump enough blood? What about the dizziness? Yes, go ahead.
Yeah, just wanted to point out that 1 out of every 5 people that attempts to climb Mount Everest dies in the attempt. And you would imagine that these are all people, experienced climbers in very good health, and even they miscalculate.
Well, think about it. Mount Everest is almost exactly 30,000 feet high, and we just heard don't go above 12,500 feet without special care.
I imagine that's, you train for it. Somebody from Florida just to go to some of the higher mountain peaks could get into crisis quickly, regardless of Everest, even half or a third of that height. Now, people go to Denver, sometimes will acclimate, athletes don't. But if you're from an area that's at sea level and all of a sudden in high elevation, that makes more sense. But what do you get nausea? What if you have abnormal heart rhythms? Does it have an effect on you all of a sudden if you get overtaxed from being in a hot tub? What about the inadequate blood flow to your heart or body and heart attack? What about medications prescribed for heart conditions? Can they contribute to the problem? What about beta blockers that lower the heart rate and limit cutaneous skin blood flow, and diuretics that increase the excretion of water and salt? I mean, do all these come into play when you start talking about seniors that are on polypharmacy and all of a sudden they're getting on a hot tub for other reasons, for orthopedic reasons, and may not be thinking of this? So it sure would be nice to have very clear-cut guidelines for physicians other than generalities to just tell people to do and not to do, and have it be research-based. But Stuart, I think you had mentioned the ethics of it. So say it's somebody like me who has a compromise, which I do, and how do you ethically study that compromise if it's cardiovascular? How does one design a study to test normal and what's capable of overtaxing the heart? What's ethical?
Well, it's a complicated issue because if you're going to design a study, the first thing you should do is review all the previous studies that have ever been done. And if the previous studies out of medical history were done in an unethical manner, it could be argued that you shouldn't be using those studies. So it's a contradiction.
And what I'm finding, a lot of the studies that I'm reading are just basically comprehensive reviews of previous studies, and they're not answering the questions. They still come back and say further study is needed. So the question is, why weren't they more specific? How do you design something that's specific for a particular malady that might be quite common? I mean, there's lots of people that have cardiovascular heart flow issues, blockages and such. But they, even within those groups, they differ depending upon the blood vessel that's involved, the collateral circulation, the presence of symptoms, their overall general health. So yeah, it gets pretty complicated, but hopefully people aren't being affected by that in hot tubs.
Jay, the bigger issue is cold water. Cold water can cause coronary artery spasm And that's why we routinely advise people in the northern United States not to shovel snow on a cold winter day if their coronary arteries are not so good.
Someone
Jay.
else? Yes, go ahead.
Yes. Yeah, I don't want to get too far off topic, but that's very typical even of drug studies. All drug studies are done on young to middle-aged men. There are no children, no females, and no elderly people in any drug study. So you have no data at all on those populations taking a particular pharmaceutical product.
Yeah, going into this next area I was going to discuss, and my concern was the physicians telling me what could happen when you get in a hot tub. Well, I'm in Florida, and all of a sudden it gets to be 30 degrees at night. You want to go in the hot tub. What happens when you immediately go from the effects of the heat to the effects of the cold, like Stuart just mentioned? Now, sure, it's not an ice water bath or shoveling snow, but in Florida, if you go from 100 degrees all of a sudden to 30, because you can generally have your hot tub outside rather than inside, does that create a stress? Is that a stressor? I couldn't find the answers to that question. I mean, what happens to your heart vessel flow when you immediately move from hot to cold? What's the effect on existing blockages and blood flow to the heart muscle? I mean, I certainly found long-term studies on cold exposure. We just mentioned about shoveling snow, systematic review, and meta-analysis of the cold exposure and cardiovascular disease outcomes that we found. And what it said was cold exposure had been considered an essential risk factor for global disease burden, while its role in cardiovascular diseases is still underappreciated. The increase in frequency and duration of extreme cold weather events like cold spells makes it an urgent task to evaluate the effects of ambient cold on different types of cardiovascular disease and to understand the factors contributing to the population's vulnerability. But for me, I'm wondering if the risk, because I can control how hot the temperature is and my fluid volume when I get in the hot tub, but what happens when I get out of the hot tub? Any comments on that winter exposure?
There's something called the diving reflex. The cold hitting your face causes a major redistribution and blood flow in your body with decreased perfusion of the skin.
Yeah, and I've read about the skin and the concern about the heat with skin, but it was also mentioned that the heart was impacted by the heat. So if it works for dilation, what about for constriction afterwards? I mean, maybe I'm humanizing this and making it too simple, complex. Go ahead, Chip.
Yeah, and the other consideration is your size, your weight, and your subcutaneous fat level. If you take a survey of all aquatic mammals, there are no skinny whales. All walruses, seals, every animal that lives in the water has a lot of subcutaneous fat. So in this instance, a heavier person is probably better protected from thermal shock getting in or out of a hot tub than someone who is skinny. N5-RTF.
Yeah, thank you, Chip. N5-RTF. Of course, the heavier people in this particular case may be the ones that are more prone to cardiovascular disease. So again, that becomes very difficult on a case-by-case basis, but in the natural world, that makes a lot of sense. Thank you for the contribution. What about considerations for pregnancy? Individuals with heart conditions or pregnancy, you should seek medical advice before using a hot tub to ensure safety. We know the heat from hot tubs can strain cardiovascular health, posing risks for heart conditions. But what about pregnancy? Can it affect fetal development, making caution essential for pregnant individuals? And what about getting pregnant? Do guys' sperm counts get affected by the heat? And is that reversible? I did find an article with a question of semen quality and infertility that was called Wet Heat Exposure, a potentially reversible cause of low semen quality in infertile men. So again, a lot of these studies are foreign studies, probably because it's a common part of life, depending upon where you live, to use heat therapy in the form of water immersion or saunas. Maybe here in the United States, we're using it more for recreational purposes, or for muscle soreness as we get older and have more comorbidities. Any comments about pregnancy or getting pregnant in hot tubs? Anybody ever talked about that as a physician to their patients?
The way you do the research, uh, you can't intentionally expose a pregnant woman to heat, but you can do a literature search to find case reports of accidental exposure and what the pregnancy outcome was.
Yeah, that be kind of hard to replicate the hot tub experience, though. Heat exposure would be one thing. Water immersion, unless somebody fell in like a hot spring and couldn't get out, and I guess that's potentially possible. So it's a very valid point. Here's something that I never thought about. And if you go to the slides, I've got a photo of my own hot tub and steps leading up to it. So I showed photos earlier on the slides of the hot tub that was an adjunct to a pool, how it was circular and you just got in it. Pretty simple to get in and out, although there wasn't handrails. But my particular one has steps going up to it, and it's elevated. And you can't submerge it because you have to, for equipment purposes, be able to get to it. So putting it at ground level doesn't work, the top of the tub at ground level. So you've got to go up steps. Well, what about ingress and egress risks? What about that sudden change in temperature increasing that risk even so? You're getting out, you're shivering, you're shaking. Are you going to fall off the steps? What about the internal design of the shell increasing the risk? I was kind of surprised that the shell that we have is pretty difficult to get into. And then it seems to be slippery, not textured. Can you have grab bars and handrails to reduce the risk? Well, that's pretty tough. Once that thing's filled, how are you going to stabilize a handrail? I guess you could bolt it to the ground and have it be fixed. And often in this particular case in mine, I have low light conditions. So what do? Turn the lights on, and for ambiance, turn the lights on. I guess you can get voice controlled apps to do that for you. Can that contribute to the risk? I don't think orthopedic injuries are at a much higher rate. Any comments from the group about that? Okay, are we frozen here, or is the Zoom still running here? Anyone like to comment?
Yeah, it's still there here, everybody. I mean, those are what you brought up are very good concerns, fairly common sense concerns, because obviously getting in and out of something with stairs, if you have any impairment, be it due to age or other orthopedic issues or balance issues due to central nervous problems, that is a danger.
Yeah, thank you for the input, Andy. And just having wet feet and getting out also adds to it. I mean, you could texture steps, but as you get older and you already have say you have a back injury, and it's all make you more prone to not be able to respond quickly when you're already having pain from your back and twisting and contorting. And if you're a senior or somebody even in your 50s, approaching your senior years, and you get a hot tub, and it's an elevated tub, and you don't think about these considerations. I didn't think about it. So far, I'm safe, but I can see where as I get another 5 or 10 years in age, and potentially have some more inherent orthopedic issues, that getting in and out is going to become problematic to the point of a lack of safety. Anyone else have some input on that?
I have water shoes or reef shoes that decrease the chance of slipping and falling.
Good point. I hadn't thought about that. Do you think they'd be working well on a smooth hot tub surface, or is it the potential where they could actually, on a wet step, increase the issue?
Oh, they're great. They're fantastic. When I just go for a swim in a regular swimming pool to do lap swimming, I wear my water shoes going to and from the pool.
Good point. Thank you. I hadn't even thought about that, and I certainly have water shoes. We'll give it a try. Any other comments? Well, thanks for everybody participating. Sorry about 20 meters being a bust here today, but not able to do it live on the air. But we've got this recorded and we'll get it to our members for the Medical Amateur Radio Council. For those of you that are watching this on YouTube, if you'd like to learn more about healthcare hams, go to healthcarehams.org. We're the Medical Amateur Radio Council. And most of us are in healthcare professions, but not all of us. We heard Bernie here today, who's a pilot offering input, and he's a former president of our organization and a long-term contributor to the organization. We've had people from many fields that are outside the core of healthcare. And watching other recordings of the Grand Rounds and the Air topic should interest you as well. So they're there on our YouTube channel. And if you've already found this presentation by YouTube, maybe you found it through a search, but if you go to the Healthcare Hams YouTube channel, you'll be able to find more. Thank you for participating and listening, and you can use the website in particular to contact us with any follow-up questions. And we're going to continue with the Zoom in just a moment. We're going to stop the recording.